Selamat pagi. Welcome back to another Bali COVID-19 update. This is December 1st, 2021, and my name is Bruce. Not a lot of good news today, unfortunately, and the weather kind of goes with it. This is almost 9 o'clock in the morning and it's dark here. I have on all sorts of lights in my room. I'm just wishing for some sun. Well, it has been raining day after day here, and some big storms, and well, keeping things dry here is a challenge. There's so much information now on the internet about the Omicron variant that, well, it's difficult to keep up with it. So there are a few things here related to the Omicron variant in general, and then the way that Indonesia is dealing with it in terms of the number of countries that have closed their borders or put in travel restrictions. That changes rapidly, and I'm not even going to deal with the numbers here. Let's just say that many countries are closing their borders in one way or another, restricting access to their countries. And about the number of new cases, yes, they're increasing, and now there's no point in going over each country individually. We just have to keep an eye on the news every day and see what's happening. And this video has been done in two parts. I did some yesterday, and then I'm just doing a couple here today to wrap things up. And I'm using my new camera, my Sony ZV-E10, which just arrived in Indonesia this past week, and testing out the video and the audio. And so yesterday I did the in-camera audio, and well, it sounded a little tinny to me, but I'm not going to go back and redo everything I did yesterday. Today I'm using a lavalier mic and testing this out, and so we'll see what the audio levels are like, and then I can go from there when I do Sunday's update. Okay, let's get started with the numbers. 7-day average for new positive cases was 13, so creeping up a little. And note, creeping. And the 7-day average for deaths steady at 1. Yesterday in Indonesia, numbers were unusually low, 297 new cases and 11 deaths. So far, so good here. Total number of individuals tested throughout Indonesia yesterday, 200,899. And a 0.15% positive rate, and the 7-day simple average positivity rate was 0.18, down slightly from the other day. No current data on Bali testing is available right now. What about the vaccination numbers in Bali? First dose, 3,450,804, 77.3% of the population. Second dose, 3,038,199, 68% of the population. Creeping up, another creeping, up to 70%, and 2,245 additional doses were administered yesterday. And what about the numbers in Bali? New cases in Bali yesterday, 13. Recorded COVID deaths, 1. Active cases, 170, and no data on the recoveries. As I said, numbers creeping up a little bit, and so nothing to be overly concerned about at this point. Let's take a look at vaccines and vaccinations. Over 3.5 million doses of COVID-19 vaccine in a day arrive in Indonesia. So Indonesia received 3.5 million doses of vaccine from various places and various brands on this past Saturday. First, the arrival of the 132nd phase of vaccines. As much as 1.3 million doses of AZ arrived. Then, the 133rd stage, 740 doses of Pfizer arrived. Then, this is all in one day, then the 134th stage of AZ arrived, 1.4 million doses. And then finally, the 135th stage was the Covovax brand of vaccine, which for the first time arrived in Indonesia, totaled 134,500 doses. So Indonesia has received around 317 million doses of the required 412 million doses. According to the Acting Director General of Disease Prevention and Control of the Ministry of Health, Pak Maxi, he said it's expected by the end of the year 75% will be vaccinated with 1 dose and 65% for 2 doses. Wow, that's a lot to do in the next 4 weeks. According to this article, 138,203,226 doses 66.3% of the population has been vaccinated one time, and 93,768,907 doses for the second, or 45.02% of the population. That's going to be an increase of 20% over the next month. Is that going to happen? I hope so. The total vaccination target is still 208,265,720, or 70% of Indonesia's targeted by the president. Okay, let's get on to the Omicron news. Omicron poses very high global risk. World must prepare, WHO. So the heavily mutated Omicron coronavirus variant is likely to spread internationally and pose a very high risk of infection surges that could have severe consequences in some places, according to the WHO. At this point, no Omicron-linked deaths have been reported, but further research is needed to assess this potential to resist vaccines and immunity induced by previous infections. And I'll talk about that next. And the WHO has urged members to accelerate vaccination to high priority groups, anticipating the increased number of new cases. The WHO Director General said Omicron's emergence shows how perilous and precarious the situation was. Omicron demonstrates just why the world needs a new accord on pandemics, he said. Our current system de-incentivizes countries from alerting others to threats that will inevitably land on their shore. And he's talking about what's happening in South Africa. Scientist Richard Hatchett, CEO of the Coalition for Epidemic Preparedness Innovations, a foundation that funds vaccine development, said Omicron's emergence has fulfilled predictions that transmission of the virus in areas with low vaccination rates would speed its evolution. And so he said the inequity that has characterized the global response has now come home to roost. And another article with some not so good news, but pay attention to a couple of the qualifiers here. Moderna CEO warns COVID-19 shots less effective against Omicron, markets tumble. So, crude oil futures shed more than $1. The Australian currency hit a year low, and the Nikkei gave up its gains. As Stefan Bansel's comments spurred fears that vaccine resistance could lead to more sickness and hospitalizations, prolonging the pandemic. The CEO told the Financial Times, "There is no world, I think, where the effectiveness is the same level we had with Delta. I think it's going to be a material drop. I just don't know how much because we need to wait for the data there. But all scientists I've talked to are like, this is not going to be good." Okay, are like, this is not going to be good? So waiting for the data is the key. And so news of the emergence wiped out $2 trillion of global stocks on Friday. Wow. Okay, so what's happening? People are starting to panic. Another story about Omicron. South African doctor who raised alarm about Omicron variant says symptoms are unusual but mild. And so Dr. Angelique Coetzee said that she first alerted the authorities to the possibility when she noticed that patients coming in had symptoms that were different from the usual COVID symptoms. And what were those? Oh, intense fatigue and a high pulse rate, and none suffer from a loss of taste or smell. And the loss of taste and smell is very common with the COVID Delta variant, which 2 of my children had. So on November 18th, when 4 family members all tested positive for COVID-19 with complete exhaustion, she informed the country's Vaccine Advisory Committee. She said that in total, about 24 of her patients had tested positive for symptoms with the new variant. They're mostly healthy men who turned up feeling so tired. About half of them were unvaccinated. And she said she had one interesting case. It was a 6-year-old who came with a temperature and a very high pulse rate, and she was thinking about admitting her. But 2 days later, when she examined her, the girl was so much better. Dr. Coetzee made clear her patients were all healthy, and she was worried about the new variant hitting older people with comorbidities such as diabetes or heart disease, and that this could be much harder on patients like this. She said what we have to worry about now is that when older unvaccinated people are infected with the new variant, and if they are not vaccinated, we are going to see many people with a severe form of the disease. South African demographics are very different. In other places, only 6% of the population are over the age of 65. That means that older individuals who are more vulnerable to the virus may take some time to present themselves. But now that the virus has spread everywhere, we should be getting some data on that. But as scientists keep warning, chill, don't panic, and wait till more studies have been done. Week to 2 weeks, we should be getting some data on just how transmissible this is and what the severity of it is. And an update on the National Task Force regulations on mobility restrictions over the Christmas and New Year holiday. I took this off of Jackie Pomeroy's site, and it says this link takes you to an English translation, including the link to the original documents at the top, thanks to Chris Dearson, who did the translation. And I went through there, and really, there's everything that I've reported on before is in there. Just to make clear, long-distance travelers using air transportation to and from areas in the islands of Java and Bali, as well as inter-district or intercity travel within the island territory, Java and Bali, must show the requirements as following: vaccine card, at least 1 dose of the vaccine, and letter information on negative result of the PCR test, whose samples taken within maximum period of 3 times 24 hours. Vaccine card, 2nd dose of vaccination, and certificate negative results of rapid antigen tests for sample taken within a maximum period of 1 times 24 hours. So this is if you're going to travel. Personally, I would not travel during this week period from the 24th until the 2nd. I stay at home. And special for routine trips by land transportation using private or public vehicles and trains in one area, urban agglomeration area is excluded of the travel requirements set out in the figure above. So if you're just moving around your city, there is nothing that you need to do. In terms of moving from one district in Bali, one Kabupaten, one regency to another, are they going to require your vaccination information? Maybe. There's no telling how this is going to play out when it actually happens. But if you're going to travel, I would have it with you. I've got mine on my app, and you can always bring a letter with you. So we'll see how this goes. The last time there were travel restrictions, we were at level 3, and they were discouraging travel from one Kabupaten, one regency to another. The enforcement was pretty lax in some areas and pretty strict in other areas. So there's no telling how this is going to play out. Stay tuned for more information. And as I'm sure most of you know, Indonesia has extended the quarantine from 3 days to 7 for everyone except Indonesian citizens who have been in the banned African countries, and they have to do a 14-day quarantine. And we'll talk about that. So let's take a look at the numbers. Okay, so numbers are a little disappointing, and well, they may be getting worse over the next few videos. And they may be getting worse over the next few videos, unfortunately. Okay, let's go on to vaccines and vaccinations, because there's some good news there. Let's take good news anywhere we can get it. So we know that, so it's clear to just about everyone that follows Indonesia or Bali that the travel ban has been extended. So let's take a look at that. Indonesia imposes travel ban over Omicron threat, but experts say more needs to be done. So at the time of this article, it had been detected in 7 countries or territories, but those numbers, forget those numbers. And dozens of countries had already banned or restricted travelers from countries in the southern part of Africa. And of course that has gone way up too, so we can forget that. And so Indonesia has joined the list of countries around the world placing a ban on foreigners with a history of being in 7 different countries in Africa and Hong Kong as well. And coordinating maritime affairs and investment minister Pak Luhut said that this quarantine period would be effective indefinitely. However, at this time, some countries that have reported Omicron cases, such as Australia, Germany, and Italy, remained excluded from the travel ban, the government said, because they've been able to isolate the Omicron cases through mandatory quarantine, preventing it from spreading among local communities. And of course, the quarantine here has been extended to 7 days. So people that were whining about 3 days, wow, now it's 7. But people are still coming in. I saw on social media today all these people planning on coming in and doing the 7 days anyway. So I don't get it. I don't get it. You want to come in and do 7-day quarantine just so you can come to Bali? To each his own. It just seems, wow, I wouldn't do it myself. According to Pak Luhut, the public does not need to panic. The government is already taking steps, such as tightening our borders, and we will also increase our genome sequencing, particularly on people arriving from overseas, in order to detect the Omicron variant. And Pak Luhut said that vaccinations would be ramped up, especially for the elderly, since they're in a higher risk group. That includes me. But I've already been vaccinated twice, a long time ago. And Griffith University epidemiologist Dickie Budiman, and you've talked about him many times, and he always has something to say in Jakarta Post articles, said a travel ban would only delay the inevitable arrival of the variant, which he believed had the potential to trigger new outbreaks across the world and a third wave of infections in Indonesia. Pak Budiman said, according to research on genomic data in South Africa, the Omicron variant was 500 times more contagious than the coronavirus initially found in Wuhan. Okay, I haven't seen that number anywhere else yet, so I'm not sure about that. Just reporting what Pak Budiman says here. He urged the government to improve COVID-19 surveillance, including through the PCR testing, whole genome sequencing, and the vaccination rate. He said genome sequencing will be the key to controlling the threat of the new variant. If Indonesia can increase its capacity, it will be in a better position to prevent a third wave. And Indonesia's genome sequencing is really far down there in relation to other countries doing this. And according to Mas Dalina Payne of the Indonesian Epidemiologist Association, although genome sequencing is not a way to prevent the new variant of concern, it's important to truly determine whether or not the Omicron variant is already in Indonesia. And anybody taking bets on whether it's here or not already? And some more on the situation in Indonesia related to the Omicron variant. Luhut explains reasons for Indonesia not locked down due to Omicron variant. So Pak Luhut said that Indonesia's preparations were much more mature than at the beginning of the pandemic. He said, in our experience, as we agree, we are far more sophisticated than what happened in the past. We are monitoring closely. I think it is quite good. So we're looking for balance, once again, the equilibrium, because the experience of lockdown has not solved the problem. He said the countries that have implemented lockdown still have experienced more attacks. And according to him, the PPKM, the way that this is done, the micro-community restrictions, is a more balanced approach. And here's an interesting article not related to COVID, but if you are a person that lives here, if you are married to an Indonesian, if you are an Indonesian, if you're a child of an Indonesian, if you're somebody that's just interested in the culture of Indonesia, this is an interesting article. Millennials hope to break sandwich generation cycle. Okay, I've never even heard of the sandwich generation cycle. So as an anthropologist, I found this really interesting. So what is the sandwich generation? According to this article, millions of millennials in Indonesia who are part of the sandwich generation, a group of people who are caring for their children or younger siblings and aging parents or grandparents at the same time. So they've got their own kids and they've got their parents and they're stuck in between. So what about them? They're mostly in their early to middle adulthood. In collectivist cultures such as Indonesia, where family plays an important role to most people, It's common for aging parents to depend on their children to take care of them and for financial support. And that's something that's been mentioned by, well, at least one of my children who said, when you're old, I want to take care of you. And I said, I'm already old. I don't need to be taken care of. Thank you. Take care of yourself. But exactly, in a culture like Indonesia where parents and family are so important, children are supposed to take care of their parents. And I know some old people who were not taken care of by their children, and the attitude of people around towards their children who were not taking care of them, yeah, definitely not doing their duty. A 2020 survey by Statistics Indonesia, BPS, found that most of the 26 million elderly population did not have sufficient retirement savings, with around 78% of elderly households, or households with at least one elderly member, depending on earnings from working relatives as the main source of income. Wow, that's a huge number. Only 6% had pension funds, and only 0.5% had assets enough to cover their needs. And the number of young people in this sandwich population are expected to grow as Indonesia enters the early stages of an aging population. The number of people 60 and over has doubled in the past 50 years. But millennials hope to cut the cycle. So there's been a growing movement among millennials, especially in urban areas, to be more financially independent in their old age and to stop passing the burden of the sandwich generation to their children. According to the Center of Economics and Law Studies Director Bima Yudhistira, millennials had a high chance of ending the sandwich generation cycle because they have better financial literacy compared to their parents and better access to information on investment options. He recommended that millennials save at least 30% of their salary, either through various investment schemes or pension plans, to achieve a secure retirement. Bima estimated that only 30 to 40% of the country's 69 million millennials would be able to save enough money for their retirement, either because of a lack of income or overspending. And he said that government needs to step in and provide better support for the elderly, and that would help remove the burden of the sandwich generation. A 2020 study by a Jakarta-based think tank, Prakarsa, which focused on social welfare policy, showed that Indonesia only spent around 2% of the state budget on elderly social protection. This pales in comparison with other Southeast Asian countries. Making matters worse, only 13% of the elderly population had access to government social programs, according to the BPS's 2017 National Socioeconomic Survey. Researcher from the University of Indonesia Demographic Institute said, however, that the government was on the right track in supporting the elderly. She said that the government has required all companies to register their employees for social security schemes such as pension plans. She said the government has required all companies to register their employees for social security schemes such as pension plans managed by BPJS, and that the government also provided extra benefits for elderly households under the Family Hope Program, PKH. And she added the government was trying to improve the database of integrated data for social welfare, DTKS, to ensure that the most vulnerable elderly were protected by social security programs. And what's happening with our neighbor Singapore? Singapore tracking Omicron Covid-19 variant closely, may be forced to take steps back, PM Lee. So Singapore is keeping a close eye on the variant. Prime Minister Lee said he's confident that the country will be able to live with the virus and held up how its people have made a lot of progress in dealing with the disease over the past 2 years. He said Singapore has to be mentally prepared for more bumps along the way as it deals with the evolving virus. So last week, the government relaxed curbs on dining out, household visits, and some social activities after 2 months of stabilization efforts. And those were introduced in September because of a surge in COVID cases. And so now they were being relaxed again, and they may have to be re-implemented, just like in lots of countries around the world. And, well, I talked about in the last 2 videos about responses in Europe to increasing restrictions, right? Huge demonstrations, riots. What's going to happen if everybody starts doing this? Prime Minister Lee acknowledged that the fight against COVID-19 has been tough on Singapore and its people. He said it's been a long journey with many twists and turns. The virus has surprised us over and over again. Repeatedly, we have had to adapt our response, pick ourselves up, and then press on. And Mr. Lee said he appreciated all of the hard work of the healthcare professionals and Singaporeans who have united and worked closely with the government and supported each other. Okay, and so let's hope things get better in Singapore. Okay, and so that's what's going on in Singapore. And what about travel? So are people going to travel? Here's one of the big things. All over Asia, everybody was getting ready to go, right? Thailand was going, Cambodia was going to go, Vietnam was going to go. Indonesia had its half-hearted opening, and Australia is getting ready to go, and the Philippines were getting ready to go, Korea was getting ready to go, a lot of places in Asia. But how is the Omicron variant going to affect this? Now remember, we don't have complete information on this yet. In fact, we have very little information on this. So maybe in another week or two, it's just going to turn out to be, well, it's another variant, and people forget about it. I don't know. We'll have to wait and see. But what about travel right now? Let's take a look at Singapore. Many in Singapore are set to go ahead with travel plans despite Omicron Covid-19 variant. So travelers in Singapore are continuing to make plans to visit countries under the VTL scheme and are undeterred and ready to push on with their arrangements despite the Omicron. And I was talking to a friend of mine in Singapore yesterday who said, I want to go to Malaysia for vacation now that it's open, and I can't get any tickets. They're booked solid. Everybody is going to Malaysia. So good news for travel, good news for Malaysia. Good news for the Singaporeans who've been locked up for a couple of years. As of today, there have been no reports of Omicron in Malaysia, although the variant has been discovered in Australia and in Hong Kong. So it makes sense that it will be discovered in Malaysia if it's not already there. Singapore bus company Transtar, one of two bus operators designated to carry out trips to Singapore, Malaysia, land VTL, said ticket sales are not impacted by the news of the new variant. And spokesperson for Singapore Airlines and Scoot said that there are no changes in their flight schedules to Malaysia, Australia, UK, or Europe at present. So, Singaporeans are going to travel one way or the other. What about the rest of the world? As I mentioned in another segment, just based on social media today, people are coming in here on the B211, even though they have to do the 7-day quarantine. How about some good news? Here's a feel-good story. We need something. I need something feel-good story. Fruit Galore Thai Monkey Festival returns as tourists come back. Thousands of monkeys in Lopburi in central Thailand feasted on 2 tons of fruits and vegetables this past week after the town's monkey festival resumed following a 2-year hiatus caused by the pandemic. The feast cost around 100,000 baht, somewhere around $3,000 US, and it's an annual tradition for locals to thank the monkeys for doing their part in bringing tourists into Lopburi, which is sometimes known as Monkey Province. Okay, I've never been there. And the organizer of the festival said today's special is durian, which is expensive. Lopburi monkeys like expensive things. Good for them. And the theme for this year's festival was wheelchair monkeys. And the organizer planned to donate 100 wheelchairs to needy people. A good cause. According to one festival worker, it's the first time in 2 years that monkeys get to eat all kinds of fruits and vegetables. I'm happy for them. It's time for a wrap-up. So what have we got? So we've got the 7-day quarantine for people coming in from everywhere except the countries that have been banned. Yes, it is 6 nights and 7 days in Jakarta. As I said before, I'm not sure why people would want to come in with that, but people do. And so if you come in and you've got information about that, please leave a comment below and tell us how that's going. As far as the Omicron variant goes, new information constantly. Very hard to keep up with. But at this point, is it more transmissible? Nobody's sure. Some people say yes already, some people say no. The best thing is to wait and see what happens over the next week or two. Severity, some people say no, and it's not, it's mild. And other people say, oh, well, it could be more severe. Again, we need to wait and get some data, so no sense in panicking about this. How is this going to affect tourism in Bali or around Asia? Yeah, it's going to have effects. But we haven't had anybody show up internationally anyway, so are we losing anything there? No, we're not at this point. People coming in on the B211A, the business reason, yeah, there may be some people that are going to be discouraged by the quarantine moving up to 7 days, but overall I don't think that's going to have a huge economic impact. The thing to think about is how the restrictions for the 24th to the 2nd are going to affect domestic travel to Bali. And nobody's really sure about that. We can only wait and see. As you can see from one of the segments on Singapore, some people are still traveling. So there's people that really want to get out and go. Is this going to slow down as new information on Omicron comes out? Possibly, if the information is bad. If the data is good, well, things may go back to normal. Hard to tell at this point. And besides moving the quarantine up to 7 days, the Indonesian government has not panicked at this point, and that is a good sign. And increasing the quarantine to 7 days, well, that's prudent on the government's part. Is the government going to increase the quarantine? That remains to be seen. We'll have to see what happens over the next week or two with news on Omicron and how rapidly it's spreading and how severe it is. If you found this video helpful, please give it a thumbs up. And if you haven't subscribed, please consider subscribing. And thanks for viewing. Thanks for all the comments. Be kind to someone today. Stay safe. Keep on hoping that things get better soon. That's about all we can do right now is hope. Stay calm. And if you're in Bali, well, I hope you stay dry. We need the water, but yeah, as I've said before, it gets kind of depressing when 9 o'clock in the morning, it is so dark I have to turn all the lights on in my room. But I think that's the least of my worries, or the least of worries in the world these days. Okay, thanks again, and I'll see you on Sunday.